Hello, I'm Cadet First Class Jonathan Schneider here at the Air Force Academy. I'm going to show you the NeuMimic system that uses a Kinect to help stroke therapy patients, and we're also going to expand to general therapy patients as soon as possible.
Alright, well this is the screen you first see when you start up NeuMimic, and what you'll see is that there's two modes, therapist and patient mode. Now if we go to therapist mode first, that'll allow us to record an exercise. So now we've got this record exercise window open, and we can create a new exercise. We can call it whatever we want, or use a exercise that already exists. And then we have two other modes, depending on the patient. We have a full body or a seated mode. The seated mode just takes the upper body, the appendages of the upper body, but full body will utilize the entire thing. Alright, so you'll see what happens as John stands in front of the Kinect is that a skeleton appears over his body, showing where all of his arms are, where his head is, where his legs are, and the Kinect can actually see those, and that's what we're seeing in those red lines. Alright,
we're about to give you a demonstration of the capabilities of the Kinect. So if you'll take a look at the screen, the red is the skeleton. So what the Kinect is doing is tracking my joints, limbs, and it can pretty much follow wherever I go. So I'm going to do a lateral arm raise. Record. Stop.
now that we've recorded an exercise, we can switch over to patient mode where we can replay that exercise. You can enter a username for that patient, and that'll bring up the main screen. We click begin exercise. We name the exercise test 1, and we can also choose from a few other set of options with this countdown timer enabled or disabled. Just for the sake of the demo, we'll keep it enabled, and you'll be able to imagine what it's like without the countdown. We can also enter the number of repetitions, and then we can begin. So now you'll notice that on John's body there's a bunch of red circles. What these indicate is that those particular joints are out of position. So as John starts to move closer to that shadow, you'll notice the red dots go away and the countdown will begin because he's in position. Now he has to follow that yellow shadow. When he successfully completes a rep, you'll hear a sound that obviously means that you completed it correctly. There he goes again. You'll notice the number of repetitions in the upper left-hand corner of the screen. So now this is the third repetition. Now if you can't quite make the full rep, you'll notice the countdown starts at the bottom of the screen. And there was a sound for a miss. So now, if he's way off, if you notice that if other joints of his body are out of position, it also will not progress the shadow. Now, before he goes back in this last time, we'll mention one more feature. This is difficulty down at the bottom. Basically, all that means is on easy, you don't have to be very close to the shadow at all, and on hard, you have to match it almost exactly. So you can make exercises more or less difficult at the patient's discretion. Or you can prescribe whether or not you want it to be easy or hard. And we'll do this final rep. Alright, so now that the recording is done, we can see that for each repetition, it tells us the difficulty at which the patient conducted that exercise and how much of the exercise they completed, whether they completed the full range of motion as prescribed by the therapist or doctor, or if they only completed a certain percentage of that motion. So with this you can actually track progress and say, over time, have I been able to complete more of this exercise?